Hi, my name is Han Tran, and this is for Nursing 190 Practicum Head to Toe Assessment. So before we get started, my patient has already done the Snellen chart test to test for distant vision, and the client's results was 20/20, uncorrected. The client states he does not wear any contact lenses or glasses. So the reason for it being 20/20 is because the client was able to read out the letters on the lines at 20/20, and so we further assessed more and had him read the line down below, and he was unable to repeat back and see at least half of the letters out of 8. So therefore, we documented 20/20 vision for him. As far as vital signs go, his vitals are 98.7 degrees Fahrenheit for temperature, and his pulse was 68 beats per minute, and his respirations were 18 breaths per minute, and his blood pressure was 120/80 millimeters of mercury. And that was when he was sitting, and that was his right arm, okay? So now that we have that, we're going to go ahead and get started. So now I'm going to go ahead and hand sanitize. Hi, my name is Hannah, and I'll be the nurse caring for you today. Please tell me your name. Please tell me your date of birth. What time of day is it? Who is the current president? Why are you here? Do you have any pain? How is your mood? Is your mood usually happy most days? And do you have any allergies to medications, foods, environmental allergies? No? Okay, I'm going to ask you about your bowels, okay? How often do you have your bowel movements? Okay, and can you tell me about the consistency and the color of the stool? Is there anything abnormal to you about your bowel movements? No? Okay, and what about your urination? How often do you urinate? Okay, and how is your urination? Good. Okay, and what's the color like? Clear. Okay, and how often do you urinate? I've already asked that. And then also, do you experience any pain, burning, or frequency when you urinate? No? Okay, great. All right, so now before we get started, is it okay if I touch you? Okay, so now we're going to start this assessment. I'm going to go ahead. I've already hand sanitized, so I'm going to grab my pen light. Okay, now I'm going to go ahead and look at the ears. So the outer ear has no drainage, no swelling. The canal is pink with minimal cerumen. Okay, now this side. Okay, outer ear is no swelling, no drainage. Ear canal is pink with no cerumen. All right, so next I'm going to have you, I'm going to check your eyes. So please, with the 6 cardinal field gaze test, just follow my pen. Perfect, and this was 12 to 18 inches away from the pen to the client's face. All right, so next for accommodation, follow my pen. Okay, client was able to accommodate. Right, now I'm going to test for pupillary constriction. Okay, so this is direct. All right, now I'm going to do it again and look at the other eye. Okay, consensual. All right, so now this side for direct. All right, now I'm going to look at the opposite side and see if it constricts for consensual. Perfect. All right, so now I'm going to look at your mouth. So if you can please open your mouth and say ah. Okay, so tonsils are grade 1. Oral mucosa is pink and moist. Teeth is white. Okay, can you smile for me? Great. Okay, can you lift up your tongue? Frenulum is midline. Frenulum is midline. And then also, can you put your tongue left to right? And then also, can you puff out your cheeks? Great, thank you. All right, so next I'm going to go ahead and assess for your JVP distension. So I'm going to put you back 45 degrees and check this side if you can turn that way. Perfect, no JVP distension. All right, 45 degree and go back. Turn that way. Okay, no JVP distension. All right, next I'm going to go ahead and palpate the carotid artery between the trachea and the sternal SCM muscle. All right, on the other side. Okay, perfect. Pulse is 2+. All right, so next what I'm going to do is I'm going to use my stethoscope, so hand sanitize. Okay, now I have this little alcohol wipe. I'm going to wipe this, and I'm going to set it to the bell side. Listen for bruits at the carotid. All right, so hold your breath. Perfect. Other side, hold your breath. Okay, no bruits. Great. So now I'm going to place this down and hand sanitize again. Okay, is it okay if I palpate your lymph nodes? Yes? Okay. All right, so you have pre-auricular, post-auricular, occipital. You have the retropharyngeal underneath the jaw, a little bit further, you have the submaxillary. Under the chin is the submental. And then now I'm going to do the supraclavicular, which is above the clavicle, and kind of hook my hands in. And then also I'm going to check where the cervical chain and also where the SCM muscle is, and a little bit behind it on both sides. Alright, so I did a 3-finger palpation of circular motion. So lymph nodes. Alright, so now I'm going to test for skin turgor. Skin turgor, skin is elastic. And also, can you shrug? Alright, symmetrical strength, resistance on both sides when they shrugged. Alright, so next what I'm going to do is I'm going to assess your upper extremities, okay? So I'm going to use the dorsal part of my hands. Alright, so patient is warm, patient is tan, no lesions, bruising, scars, any abnormalities. Okay, so if I palpate, there's no pain, right? No pain, okay? And there's no edema or bony prominence is noted. Alright, so I'm going to do capillary refill. Alright, less than 3 seconds. Alright, now this side. Less than 3 seconds, great. Okay, now I'm going to test your range of motion. If you can do me a favor and put your hands up, touch your elbows. Straight forward. Up. Now if you can do this at a 180 all the way while your hands are touching. Perfect, thank you. Alright, so now after that, I'm going to go ahead and do your reflexes. Okay, so I'm going to hand sanitize. I'm going to grab my hammer, and I'm going to make sure to sanitize this properly on both sides, the small and the long end. So first, I'm going to test for the bicep reflex, and this is to test for forearm flexion. So the way I'm going to do that is I'm going to use the small side of the hammer. Okay, I'm going to put my thumb here in the antecubital space. Alright, relax. I'm going to hit my own thumb, okay? Perfect. Now I'm going to do the other side. Perfect. 2 plus reflexes. Alright, now I'm going to go ahead and test the tricep reflex, and that is to test for forearm extension. Okay, and I'm also going to use the smaller side of the hammer. Alright, so relax. Okay, I'm going to support the arm. And also I'm going to turn it a little bit to the side because I need to get a little bit behind and above the elbow where the tendon is. Perfect. I'm going to check the other side. Alright, a little bit above the elbow where the tendon is. Perfect. And now I'm going to go ahead and switch over to the long side, okay? So I'm going to test for supination with the wrist. So please relax. Alright, and now I'm going to support the arm 2-3 inches above the wrist. Perfect. Now the other side. Perfect. Reflex is 2 plus. Now lastly, I'm going to go ahead and check the reflexes for the knees. Have you had any knee surgery? Any injuries? No? Okay, perfect. Now I'm going to go ahead and ask you to dangle your feet over, relax. Now I'm going to hit where the kneecap is, right below it, where the tendon is, the long side. Perfect. Perfect. Alright. So now I'm going to place this back down. Hand sanitize. Alright, so next thing, I'm going to check your chest configuration. So chest configuration looks like it's symmetric, no barrel chest, no abnormalities. Skin looks good, no lesions or anything that looks abnormal. Alright, so next I'm going to go ahead and place my stethoscope on. Okay, I'm going to hand sanitize. Okay, I'm going to clean this. So I'm going to listen to the heart. Alright, with the diaphragm. So I'm going to make sure this is on the side of the diaphragm. Okay. So first we have the second right intercostal space is the aortic. S2 is louder. And then over here we have the left second intercostal space. Pulmonic, S2 is louder. And then below that third intercostal space we have Erb's point, S1 equals S2. Then we have fourth intercostal space on the left side, and that is tricuspid. S1 is louder. And then a little bit over more to the left at the midclavicular line at the fifth intercostal space we have the mitral or apical. S1 is louder, and here we're going to listen for a full minute. So we have 68 beats per minute. Thank you. Alright, so next I'm going to take your assess your respirations, okay? So every time I move my stethoscope, take a deep breath. So 6 spots, we have 1, 2, 3, 4, 5, and 6. Great, thank you. Now I'm going to come over here. Please raise your arm. Okay, at the 4th and 6th intercostal fourth and 6th intercostal space, mid-axillary line. I'm going to test for the lateral. Alright, thank you. So front, anterior, and lateral are all even and unlabored. Alright, so now we're going to go ahead and move you to behind, I'm going to do 8 points here using the diaphragm. So we have 8 points. 1, 2, 3, 4, 5, 6, 7, and 8. Perfect. Okay, posterior breath sounds were even and unlabored. So now I'm going to hand sanitize. Respiratory expansion at T10. Perfect. Thank you very much. You can go back around. All right, so now we've done your respirations already. Now we're going to move on to the abdomen. So inspecting the abdomen, there's no masses, no lesions, no abnormalities, no skin discoloration, no scars. Okay. Now looking at it, the umbilicus is midline. Okay, it's right here. All right, so this is part 2, and now we're going to be doing the abdomen. Okay, so first I'm going to go ahead and inspect the abdomen. Okay, there's no masses that are visible, no lesions, no scarring, no discoloration of body, okay, in the abdomen area. All right, so I'm going to turn the patient right here so I can check for pulsation at eye level, okay? No pulsation, and also the abdomen is slightly rounded. After inspection, I'm going to see the umbilical is midline, okay? So after inspection, I'm going to auscultate, so I'm going to hand sanitize. Okay, get my stethoscope, and I'm going to wipe this, both sides. All right, I'm going to use the diaphragm side and make sure it's on the diaphragm and turn it. Okay, I'm going to listen to all 4 quadrants for 15 seconds, starting at the right middle quadrant. 15, 15, 15, 15. Okay, so I heard 16 to 20 gurgling sounds. And next, I'm going to switch over to the bell side. Listen for bruise, okay? The left side of the abdomen. So, no bruise present. Great. All right, now I'm going to go ahead and hand sanitize. All right, so after auscultation, now I'm going to go ahead and percuss. Indirect percussion, I'm going to use my middle finger on top of my middle finger and tap. Okay, all 4 quadrants. Tap, 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 tap. All right, timpani present in all 4 quadrants. After that, now I'm going to go ahead and palpate and do a light palpation. Let me know if you have any pain or tenderness. Any pain, tenderness, any pain, tenderness, any pain or tenderness, any pain or tenderness. No, great. All right, so after that, I finished the abdomen. Now I'm going to go ahead and go to the lower extremities. Okay, so lower extremities, first I'm going to start off by checking the warmth, dorsal part, okay, it's warm, color is tan, no abnormalities of skin abnormalities as well. Alright, so after that, now I'm going to go ahead and check for edema. Or bony prominences, no edema. Okay, great. Now after that, if you could please, I'm going to check for the pulses. So we have the popliteal pulse behind the knee, okay, both at the same time, 2+, great. Now, posterior tibialis, inside where the ankles are, at the same time, 2+. Now the dorsalis pedis is on top of the foot, in the middle of the foot, between the first big toe and the toe, okay? So I'm going to do it at the same time, 1+. All right, now I'm going to inspect the lower feet. Bottom looks normal, okay? No abnormalities, no lesions, bruises, or anything discoloration. Okay, so next I'm going to test for range of motion. So if you could please press down, perfect. Press up, perfect. Now put your knees to your chest if you can, and wiggle your ankles, wiggle your toes, perfect. Range of motion is great. All right, so I'm going to check for capillary refill on both sides, less than 3 if I haven't already. And then after that, now we're going to go ahead and do the cranial nerve test. So cranial nerve test, the first one we're going to do is the smell test. So I have 2 cents here. Please close your eyes and cover one nostril. Okay, what do you smell? Listerine, great. Now cover the other nostril. What do you smell? Rose, perfect. Now we're going to do the whisper test. Okay, with the whisper test, I'm going to stand about 1 to 2 feet away from you. Okay, cover this ear. I'm going to whisper. Repeat back to me. Orange, orange, great. Now this side, okay, cover this side. Apple. Okay, great, thank you. Alright, now if you could please do me a favor, the Romberg test, close your eyes, hands to your side, and then feet together, and then close your eyes for about 20 seconds, 20-30 seconds, and if you fall, I'll catch you, so don't worry. Okay, so next, after that, I want you to walk 5 feet straight. Okay, turn back, and then walk from heel to toe in a straight line. Okay, perfect. Now if you can copy this motion. Okay, perfect. Next, can you have your heel to your shin on both sides and rub them up like so, both sides. Okay, perfect. And that's all that we have for you today. Thank you very much.